it's Lisa DeBoer coming to you live for the Give Me 5 on Friday, and I'm here with paramedic and dog trainer Xavier Indart, and we have making her first camera debut. This is Sky. This is our puppy. She is 7 months old now, but we had a little incident a couple of weeks ago when her brother came to visit and fell in the pool right behind us. We were able to get him out and he was okay, but we thought this might be a perfect chance to do a fur baby episode, because you know we're all about saving babies and stuff. So today we're gonna have Xavier talk a little bit about CPR for a dog. It came up when we were teaching in Tucson the other day, where we were doing a disaster class, and we incorporate canines into that class, and people were really interested and had a lot of great questions about how do I help a dog in distress or that's been hurt in any way. And so Xavier's been kind enough to come on our episode today and talk about some basic things with taking care of our fur babies. Xavier.
All right, so main thing is if you're dealing with like a submergence incident is obviously is airway management. So time frame of how long the dog was underwater for. Remove the dog. First thing you want to check is make sure you clear an airway. So try to open the dog's mouth, hold in a position where it's almost like an upright position and comfortable.
So and open her mouth like this.
We're going to try to open her mouth. Okay, and then see if there's anything obstructing, any type of fluid that's coming out. And for like foreign body airway obstruction, it's the same for dogs as it is for people. So we're going to go ahead and put it on her side, and it's going to be compressions at a rate of 120 per minute.
Okay, so a little faster than humans. Okay, yeah. So like so she's on her
side.
On
her side. And then compressions are going to be right behind this front shoulder. So thumb placement is right behind the front shoulder and right here on the palm on the rib cage. So compression depth is going to be 1/3 to 1/2 of the depth of the chest. Depending on the size of the dog is obviously what's going to differ how deep you do compression. So on a smaller dog, it'll be 1/3, just like a difference for children and adults.
Right.
So for bigger dogs, it's going to be half the chest. So compress half the depth of the chest.
Are we going to encounter rib fractures like
so,
we do often in adults?
As far as cartilage and bones for dogs, there's more cartilage per se bone area than there are for people.
Okay.
So yes, there is going to be some broken bones and maybe some broken cartilage. But recovery time for dogs apparently is they bounce back pretty quick.
Okay, so kind of like kids. They say if a kid has a broken bone, and you can pretty much put one end in each end of the room, and they're going to heal one way or another. So dogs are kind of like that.
Correct.
All right.
So your main thing you want to check, obviously, is the dog responsive? If it is responsive, address any injuries or illnesses from that point on. If they're unresponsive, you want to do a pulse check. So the saphenous vein, which is back here on the hind corners, on the inside of the thigh, you're going to go ahead and feel it, and you're going to look for anything 120 and up. So that would be normal pulse rate. Anything over 120, you're going to consider that being the first stages of shock. 140, that's decompensative, and anything less than 140 or less than 80, now you're looking at terminal. This is irreversible.
That was really easy to find, just like that. I was able
it's
to
a
find that
very big vein. A lot of this is used also for fluid replacement therapy too.
Okay.
Big veins like that. Hi, thank you. So yeah, coming from the submergence incidents, we're going to go ahead and start doing your 120 compressions per minute, and obviously reassessing your airway and your patient's condition as such. Okay. Now, in the face of pulseless and apneic, not breathing, so you're still going to do your 120 rate per minute. After that, you're going to give 2 breaths, and the way to give 2 breaths is you're going to encompass the mouth, making sure that the lips are together and the jaw is closed, and you're going to wrap your lips around the nose completely and give half a breath. So for your inhalation, it's half, and that's as much as you're going to give the dog. So volume-wise, tidal volume, if you guys are talking about BVMs, it's going to be 10 mLs per 25 kilos.
Oh, okay. Come here. We're not going to actually give you CPR. Promise.
So yes, after that, then you can think about airway management. Then from there, once you have pulses established, then you move to rescue breathing, just like if it were to be a regular person, and it'd be 10 to 12 breaths per minute.
Okay.
So remain in a recovery position. The recovery position for a dog is going to be on its side, just like it would be for a normal person. And then any other life-threatening injuries or illnesses, be sure to expedite as soon as possible to your vet.
Awesome. Well, thank you so much for coming on and talking about some basic things for our fur
Yeah, no, it was
babies. I
my
appreciate
pleasure.
it.